I'm Dr. McDaniel. I'm part of the second class of graduating residents at Trios and soon to be attending internal medicine hospitalist here. I was just always interested in science and kind of interested in healthcare, and it seemed like, anytime you're worried about yourself or worried about a loved one, you could go to the doctor and get answers. And I kind of wanted to know what those answers were. So, I was fortunate enough to have opportunities every step of the way to kind of advance my education, and luckily for me it worked out, and I didn't get sidetracked along the way, and I was able to complete my training, and it's fulfilling, and I know now that doctors don't have all the answers. I was looking for somewhere where I knew that I'd be kind of more of a valued member of the medical team in the hospital. And not that there won't be times where you may feel like you're kind of low man on the totem pole, because you are, but I got a sense of they were more concerned about what my well-being was, and they were concerned about me learning and becoming an effective physician. I feel like all of that's been provided to me. They were quite scary, actually, and I think that's a general experience for interns around the world. Just kind of the months or leading up to starting residency, I'm like, they're gonna know I shouldn't be here. But no, they start, anywhere you go, they're gonna start you off slow, and they kind of ease you into things here, but. You're writing prescriptions with your name, you're putting orders in with your name, and that's a new thing for any intern. So there's some responsibility, and there'll be some positive feelings you get from that. You're a doctor now. You become familiar with things that you encounter, and you learn from somebody who's been doing it, either as a hospitalist, as an outpatient primary care, or gastroenterologist, infectious disease, cardiology, somebody who's been doing it a lot longer than you have, and you'll encounter common things commonly, but the rare things as well. And I think having that familiarity with your attending and kind of not being scared to ask questions, that's how you learn. It's changed in the sense that I can stand there in front of somebody and be confident that what I'm telling them in regards to their health care and what needs to be done next is something that I'm basing off experience here as a resident that's prepared me to be effective. Jet skis, boating. So there's a lot of agriculture in this area. There's a pick and eat, I guess they call it, orchard, Ray French Orchard over in Richland, where you can go and get seasonal fruits. So every year I go cherry picking there, and we make fresh cherry pie. I've gone out fishing a couple times on the Columbia River and caught some delicious walleye, and it's quite a thrill to go fishing, and you can actually go fishing for the big sturgeon as well. The residents here, we're all around the same age group, and we all get together and do barbecues, and go out to dinner as a big group and stuff. So that's a lot of fun, and sometimes the attendings will join as well. So it's a good atmosphere where when we're at work, we're professional and we get business done, but when we get off, we can relax and unwind and joke with each other and have a good time. So. I think first off, when considering a residency program, a person needs to identify their goals and kind of look at what they're looking for themselves long term. For me and for here in this residency program, I think that one of the things that attracted me to it initially was the newness of everything, the new hospital. It's a relatively fast growing community, so there's a lot of new homes, new stores, new businesses in the area. But also, you know, the fact that the residency program's only a few years old now. So this is our fourth year of interns. So you're going to have a lot of impact on what's going to impact the program from years to come. You'll have a chance to, you know, kind of make your personal impact left on a place. You know, whether you consider that a legacy or not, I don't know. But you know, you definitely will be asked for more input here. A lot of people who work here are born and raised in this area, whereas like a lot of the bigger cities, you know, you're not necessarily encountering that. So a lot of people who work here have like a personal and not only investment in the community, but a personal investment in the hospital. In closing, I think I would summarize my residency experience as being a positive one. Definitely a lot more good times than bad times. You know, definitely stressful, but nothing more than is expected of you and nothing more than you can handle. So I'm going to be staying on here at Trios, and I think that that's a reflection of, you know, how positive my experience was that I wanted to continue it here. And I hope that, you know, anyone, you know, who's interviewing here would be open to having that same experience. And I think it's definitely an experience that's shared with some other residents of mine, no matter how tortured they may feel like they are at the current time. I think everybody in general is pretty happy. And yeah, so I would recommend, you know, if you're coming out here or thinking of applying, it's a great area, great weather, good people. You're gonna, you know, really enjoy your time. You're gonna learn a lot, and you know, hopefully come out on the other end a better physician and ready to tackle practicing on your own. So, good luck.